Warm welcome to this video and welcome back to Ross Neelan, cook from Australia. Welcome, Ross.
Thanks for having me back, John.
Most people remember you are a psychologist, although currently not practicing psychology for various difficulties. Now, what I want to start off with, Ross, we did talk about this on the last video, but I just want to make it clear and overt. You've started something called the Cape Byron Lighthouse Declaration. Now, who is invited to sign this? Is it just for clever people, or can people like me sign it?
Absolutely, it's for everyone. Anyone of any trade, profession, country, everyone's invited to sign it, definitely.
So it's a bit like an international petition, really, then.
It is. It's an international movement. Several people have asked, is it just the Five Eyes countries or England, America and Australia? Because at the moment they're the only flags we have on the declaration, and that's certainly not the case. We're looking at adding many more lighthouse keepers from as many countries as possible.
Excellent. So can we look at them briefly? The first declaration, all silencing and censorship by bureaucrats and regulators, including of experienced practitioners and scientists, must stop. Yes. There must be respect for every individual's right to freedom of opinion and expression. Why did you feel it was necessary to put that in, Ros?
This is a really important point, John. There has been so much silencing and censorship of experts around the world, and I'm not including myself in that. I'm talking about the medical experts that had a very different way of looking at the COVID measures, the pandemic measures taken around the world by the government. And science is based in argument, in hypothesis testing, in negating the hypothesis, as it were. Yet by censoring health professionals that had different viewpoints on this, that's negating science. It's negating the scientific method. And the fact that most of those calls have come from bureaucrats around the world without science degrees is beyond frustrating. What I've asked for, and what we're asking for here, and what I asked for on the video I first made, was that this public debate is allowed to happen. And really, if you consider it from a logical viewpoint, if the sorts of questions that people with alternative narratives were raising were nonsense, they could very easily publicly refute that by allowing debate. But the fact that they haven't allowed debate and have so heavily censored us, and in many countries like Australia specifically gagged us, put gag orders on us, on medical professionals, for questioning any government policy, I think is really quite telling.
Mm-hmm. And I know you could always put more words in these things, and we need to keep it concise, but we could add maybe rich people to bureaucrats as well, potentially.
There's a lot of them involved, that's for sure. Another
problem in this world. Right, yes. The next one, the right to informed consent must be upheld and must include being fully informed of relevant risks as well as any benefits proven or presumed. What was your underlying concern for that one?
There were several. Informed consent is a piece, I'm not sure in nursing, John, you can maybe talk to that, but certainly in psychology, we are drilled again and again throughout our studies about informed consent, and that we...
100%, Rosa. In nursing, in medicine, informed consent is an absolute fundamental axiom. We do nothing without the patient's consent. In very rare instances, when a patient is comatose, for example, we might get consent from a relative, and if we absolutely have to, if there's no consent available, we'll act in the patient's best interest.
Yes.
But informed consent is fundamental, absolutely.
Fundamental and a huge part of our training. And as you say, if someone's in a coma or in the position of children, there are still huge amounts written. It's not then that you can just jump in and make a choice for them. Right. There's still all sorts, in Australia, written into statute, written into our ethical guidelines and various codes of conduct. And what we're primarily getting at here was the informed consent around vaccines, the informed consent around mask mandates and various other pieces. What we now know, I think it's, if you're happy for me to say this on our channel, is that we're well aware that there wasn't informed consent about the vaccines. The clinical trials certainly hadn't finished, and from everything I've been told, but I have to qualify that by saying I'm not a medical professional, I am a former psychologist, was that the pharmaceutical companies already knew and had started the clinical trials and already knew that there were all sorts of very problematic results coming in from those early clinical trials on the vaccines, yet they weren't being communicated. So, I did say in the last interview that we did, it was like having a gun to your head to go and get this vaccine. And I mentioned that you would lose your job. I mean, you would lose a lot of things. Losing your job isn't just losing your job. For the vast majority of people who have mortgages, all sorts of, loans, etc., based on their work, it meant that they would lose their house, their livelihood. And those sorts of, that's our most primal need. What do we do if we lose our house? And one thing I would like to say is that the reason I was able to speak out, and I want to be honest about this, I own my own house. And I don't own a palace. I own a house that needs a lot of work done, that's riddled with mold and it's made of asbestos. It's far from the ideal house. However, it's mine. And so they could never actually take that away from me. So I've had a lot of correspondence with people who say, we would love to speak out, but we're early career, we have all these loans and mortgages and all these financial obligations that are based on our receiving a salary, and we can't speak out. So I do want to acknowledge that. I really do understand how incredibly difficult it is for younger people. That's one of the reasons that, I call out to those that are older, those that are retired, those that don't have those financial constraints on them, because it's incredibly important that we have enough people speaking out that aren't at risk of losing everything that they own, being homeless. It's a huge, if you look at it from sort of Maslow, who I'm sure you're aware of, Maslow's hierarchy, right? Fundamental needs, safety, house, dwelling, food. You could potentially lose all of those if you speak out. So that's what that one's about.
The other thing that raises in my mind is these axioms that we've predicated our professional lives on. The erosion of these has been so almost casually accepted with minimal resistance, and that is surprising and disappointing.
There's so much disappointment in this, isn't there, John? I mean, really, so many of us signed up, as you say, for these axioms and these codes of conduct with integrity and absolutely believing in them. And then when the floor's ripped out underneath practitioners based on these points, it's incredibly destructive and disappointing. I think too mild a word to put on it. It's heartbreaking.
In England, we understate things. We tend to understate things a little bit. So we've got a situation where fundamental science that we spent all our lives learning hasn't been applied.
No.
Fundamental ethical principles that we've lived our life by haven't always been applied, and
that's right.
That needs to change.
Science has been
third
out
one.
the window, pretty much.
Sorry?
Science has been thrown out the window. The scientific method, as we knew it, has gone.
And subjugated to vested interest.
Very highly vested interests, yeah. Sadly.
Third one, Ros, there's only four, so stick with us, please. Mandates and other forms of medical coercion are unethical and must cease. Bodily autonomy is the inalienable right of every individual and must be respected.
Yes, and that sort of
pretty obvious.
It is pretty obvious.
Why did you need to put that in?
because it's been forgotten, because the governments have forgotten these pieces, these mandates, and everyone's, various governments around the world are sort of trying to wheedle their way out of this, as it were. And many are turning around and saying, well, we didn't mandate it. The companies did, the corporations did. But we know that the extent of the coercion, and again, people had a gun to their head, was horrific. It has to stop. If there is nothing to, I suppose, hide from, why would you need to mandate people if these measures they were bringing in were correct and clean, then why would you need to mandate people into doing things that they absolutely didn't want to do? I don't know about you, John, but certainly the vast majority of people I've spoken to, whether it's friends, people I've met through this, have said very clearly they would never have taken these injections had their career not been at risk, had their house not been at risk. So
that wasn't really the case for me, but when I've talked to scientists, statisticians, people around the world, and they've told me things that were known by certain groups at the time but were not known by me and were not in the public domain at the time, I must have said that a dozen times. There's no way I would have taken that if I'd been given full disclosure.
No, absolutely.
Therefore, I must assume that I was not operating under informed consent, because I was operating under knowledge that particular narrative controllers wanted to reveal to me, and other aspects of knowledge which would have allowed me freedom of choice.
Absolutely.
We're hidden from me. And that'll bring us on to a point we're going to mention in a minute. I just want to do the fourth one before we go on to the reaction. But the fourth one is there's an urgent need for transparency and the reform in science and medicine, and to halt the increasing globalization of public health. We demand the restoration of voice and decision power to individual practitioners and to those they serve. Why was that necessary to include?
That piece is incredibly important because the transparency is not there. As we've talked about before, the widespread censorship, lockspread censorship of the major media corporations around the world has been incredibly difficult to get past. And again, if the true story is not being told, if people aren't hearing about potential risks of vaccines, then the truth is not coming out. We need to hear the alternative narrative. We need to get the media away from this. It's not the media's place, or strings of bureaucrats around the world to start jumping in and telling us what's right. The people, and I don't put myself up as one of them. You may, John, because you have a medical background. I have a psychological background, and so what I can see is huge amounts of propaganda and huge amounts of censorship and nudging. But what we need to see is true scientific debate. It sort of feeds into the other ones, allowing people who have very different stories, very, very senior medical professionals with incredible skill sets behind them, to be able to be heard and debate these points publicly.
Yeah. And we'll put the link there, the petition's there. It's basically a petition. Am I right in saying it's basically a petition? Anyone can sign this?
Anyone can sign this petition.
Who agrees to these points?
Yes, absolutely anyone can sign this. There has been a bit of concern from people who were worried about their names being divulged. The privacy policy on there was something that I spoke to a local human rights lawyer about, and that was what he gave me. We're not planning on publicising everyone's names at all. So for people that are concerned about that, that's not the case. We also had some concerns that some of the fields in the sign-up form were mandatory, that we've now changed. So now we're just asking for names, emails, of course, and country, because we want to know which countries people are from. But the ones with addresses, etc., and people that have been concerned about that, we've removed.
And if you get 10 million signatures on this, who will you send it to? How is it going to change anything in the real world?
It's really about, I mean, this is all, from my point of view, strategic psychologically. At the moment, there are still many, many people who think we have a very small minority, like yourself, myself, and other lighthouse keepers, who are somehow desperately uninformed, conspiracy theorists, anti-vaxxers, all those labels we constantly get put upon us. It's about providing safety in numbers. Will we send it to government, etc.? Maybe. I don't have a sort of clear position on that. It's more about showing people who are frightened and who are still sort of coming into awareness that there are large numbers of us, rather than sending it to governments. I don't actually have a lot of faith in any of the governments anymore whatsoever after what I've seen the last few years. And I hate to say that. It makes me sad to say that. I wish we could. But that's not the case. I believe the government, the systems that are currently run us need to change fundamentally. I don't have the answers to how that might come about, but it's about safety in numbers. It's the group psychology piece I think we spoke about last time. Did we speak about that?
On the last video, we spoke about all sorts of fascinating aspects of psychology, and I will be putting the link up, so don't miss out on that video. It was really good.